fine.
Okay.
We are waiting.
So I think, ma'am, I think we can start the webinar.
We have 30 participants now, Dr. Ankur.
Yeah. So I think, good evening, everyone. On behalf of Telemedicine Society of India, Uttarakhand chapter, this is our first webinar today. And we have, started the association on 10th of December, 2022. And I would like to, may I request Professor Meenu Singh, ma'am, our President of TSI India and Executive Director and CEO M. Rishikesh for her presidential address. Ma'am, please.
Thank you. Thank you very much, Dr. Ankur. Actually, I was traveling, so I have just come back. And it's really nice that you have organized these webinars for everyone. And this first one about the kidney disorders will be a very interesting one for everyone. So please go ahead with your.
Thank you, ma'am. So may I request our Honorary Secretary, Dr. Murthy Ramila, sir, who is the Honorary Secretary of TSI and very energetic, enthusiastic person, for his welcome address, please.
Yeah, good afternoon or good evening, everybody. I hope all are in India only. So good evening to everyone. I'm very happy to see that the latest state, except Haryana, which was inaugurated 10 days back, has taken the initiative and going ahead with this program. Earlier, I suggested every month we should have some program or the other so that every state can be active, and yearly out of 12 months, 10 months, we can have 10 events per each chapter. So I'm very happy Ankur Mittal has taken this initiative, and luckily he is supported by Dr. Meenu Singh, who is her boss, who is his boss, as well as my boss in TSI. So she is the president at the national level and the president of the Uttarakhand chapter. And I am glad that today Dr. Vikas and Harshit are taking care of the first session, which is prevention of the kidney stone. And the other one is prevention of the kidney disease by Sharan and Devda. This is nowadays, these kidney problems are increasing more. So I request probably that maybe in the part of their curriculum or portion what they are covering, but I wanted them to say prevention, focus more on prevention, as the heading says, how to avoid that, and then what are the regular day-to-day habits to be changed for that, and how to guess it at the earliest. With that, I close my remarks and let's get into the technical content, and all the best to the speakers, and thanks to the speakers, and kudos to team Uttarakhand.
Thank you, sir. Thank you for your wonderful words. So now actually, I would just give a brief introduction, because this March month, basically every second Thursday, we celebrate World Kidney Day. So I think on that behalf, the theme of today's webinar is kidney health. So as we understand the kidney health for all, and we need to prepare for the unexpected and support the vulnerable. So the two common diseases and most common diseases which are really necessary for kidney health will be taken care by the experts today. And with no delay, I would like to introduce Dr. Vikas Kumar Pawar. Dr. Vikas is Associate Professor in Department of Urology, All India Institute of Medical Sciences, Rishikesh. And I will hand over now to Dr. Vikas to go ahead with the session 1, which is prevention of kidney stones. Dr. Vikas, please.
Thank you so much, sir, for such a kind introduction. First of all, I would like to thank Telemedicine Society of India, Professor Meenu Singh ma'am, President TSI and Executive Director and CEO AIMS Rishikesh, Dr. Murthy Ramila, Secretary TSI, Dr. Ankur Mittal sir, Secretary TSI UK chapter, for giving us an opportunity to speak on such an important topic in this Kidney Day month. So, renal stone disease has been affecting humans throughout the history, and the procedure regarding removal dates as back as 600th century BC. If we look into the global burden of the disease, around 15% of the population of world is affected once in a lifetime. And this translates into around 22 million cases and 16,000 deaths annually. And this data shows that there is a growing unmet need of primary prevention with regard to this disease. And if we see, if a patient has had a renal stone, the 5-year recurrence rate of renal stone disease is as much as 50%. So with this data background, I now invite upon Dr. Harshit Agrawal to speak on the prevention of kidney stone. Dr. Harshit Agrawal is pursuing MCH Urology course in Department of Urology, AIMS Rishikesh. Dr. Harshit, please.
Good evening, everyone. It's my pleasure to discuss this topic everyone. So today our topic of discussion, as sir pointed out, would be prevention of kidney stones. So before getting to the prevention part, first thing I would like to talk about how much does it affect us as a society. The lifetime prevalence of kidney stone is estimated to be about 1 to 15%.
Dr. Harshit, your voice is breaking. So can you just, Dr. Harshit, can you again log in and we're just waiting for Dr. Harshit to again log in and start the presentation. There were some issues with the network.
Am I audible now? Hello?
Yes, Dr. Harshit, you are audible and your slides are visible. Can you just start again, please?
Yeah, I'm sorry for the pause. So coming to the disease burden, so how much do these renal stones affect? In India, it's about 12% of the population that is affected by these renal stones, and out of these, 50% of the population is severely affected by these by the renal damage these stones cause. The effects which renal stones cause include renal colic, pyelonephritis, which is infection of the kidney parenchyma and pelvic ileal system, and loss of kidney. Economic cost, which includes loss of wages of the kin who are there to take care of the patients, and associated mortality, which can be there because of the complications of renal stone. Here is one of the image of the kidney, which was ridden with multiple renal stones, as you can see here, which had damaged the entire kidney and had to be removed because of recurrent infections. Coming to the risk factors, the one of gender being one of the risk factor, it's more common in males compared to females. Next is age. It's more common fourth to sixth decade of life. And particularly, higher prevalence of renal stones is found in hot, arid, and dry climates such as mountains, desert, tropical areas. And Uttarakhand being a little mountainous terrain, it is relatively common in Uttarakhand also. Heat exposure and dehydration constitute an occupational risk factor, particularly people those who work in foundries or near furnaces. They are at higher risk of getting these renal stones because of dehydration. Prevalence of renal stone, it correlates with weight and BMI and is associated with multiple systemic disorders, including diabetes, metabolic syndrome, cardiovascular disease, and CKD. So one of the most important questions before understanding how can we prevent renal stones is why do stones form? So it basically begins when there are two components to any precipitation or stone formation. It includes a solvent and a solute. In this case, solvent is the urine, which mainly contains water, and the solute is various chemicals which are being secreted by our kidneys, which include calcium salts and other uric acid and other chemicals. So if the concentration is such that solvent volume is less, that is water is less in the urine, and the solute concentration is more, it precipitates and form renal stones. So that is the basic pathophysiology, and we'll try to counteract that. So main stone composition which is seen in renal stone diseases are most commonly are calcium containing stones like calcium oxalate, hydroxyapatite, and brushite. Well, non-calcium containing stones include stones like uric acid, struvite, and cysteine. So factors which can be there affecting renal stone formation include fluid intake, dietary choices, genetic factors, metabolic abnormalities, anatomical abnormalities, drugs which are taken by a person. These all include things which can cause stone formation. Few modifiable ones are fluid intake, dietary choices, and to an extent, anatomical abnormalities can also be corrected using surgery. So the general recommendation regarding primary prevention of renal stones, let's come to that. First part is lifestyle modification. So first part is fluid intake. So the most important part is increasing the solvent component of the urine, which is primarily water. So we can reduce the risk of developing kidney stone by drinking adequate water. And how do we define adequate water here? It is defined as more than 2.5 liters of urine per day. So this water intake quantity can vary in summer months as compared to winter months. So people are usually more dehydrated, more exposed to sun and heat, thereby causing more loss of water by perspiration. So relatively, water intake should increase in summers, but overall it's seen if the urine intake is at least 2.5 liters, it decreases stone formation risk. And comparing many other fluids like juices and other sort of beverages, what is the most preferred fluid for decreasing risk of stone formation? Next factor, dietary modification. Food and vegetable intake should be increased because food and vegetables are basically alkaline in their nature. So this increases the urinary pH. One thing important about calcium and calcium oxalate, uric acid stone is they form much more easily when the urinary pH is acidic compared to when it's alkaline. So as the urinary pH increases, thereby the risk of stone formation decreases. But we should avoid increasing food which are high in oxalate, like walnuts, spinach, and chocolates. Coming to the dietary recommendation part of it, although vitamin C is said to be precursor of oxalate, but its risk factor in multiple studies have been shown to be either pro or against stone formation. But animal protein intake should be limited to zero point 0.8 to 1 gram per kg body weight per day, because animal protein, as we all know, is high in oxalic acid content and rich in nucleic acid content, thereby causing increased uric acid secretion. It also has less citrate compared to vegetarian diet, so thereby it causes hypocitraturia, which increases calcium stone formation risk. Another important part, which is very common among common population, thought among common population, is that one should decrease their calcium intake if the calcium stones are forming. That is absolutely not correct. Calcium should not be restricted, and one should continue taking the daily requirement, which is 1 gram to 1.2 gram. But calcium supplements as such are not to be recommended except if they are recommended by your urologist or your physician in case of enteric hyperoxaluria, when additional calcium actually decreases the stone formation. Coming to dietary modifications further, purine-rich food, particularly like seafoods, soft drink, alcohol, these have high content of nucleic acid content, which have purine, and these are excreted as uric acid. Since these uric acid crystals form uric acid stone and also increase risk of calcium oxalate formation. So thereby, one should not have higher than 500 mg per day intake of these contents. Daily sodium intake, that is sodium chloride, which is most common used form of sodium intake, should not exceed more than 3 to 5 gram, because increased sodium in the diet increases calcium excretion, which is increased by because tubular reabsorption accordingly decreases for the calcium. Urinary citrate is also reduced because there is loss of associated bicarbonate, and there is increased risk of sodium urate crystal, which is there, which causes uric acid stone precipitations also. So thereby decreasing one's salt content in diet helps in reducing stone formation. Coming to dietary modifications further, fruit juice, the primary way fruit juices are considered to act is because they are alkaline in nature, and they also contain citrate, both of which are stone formation inhibitors. So considering that, it's mainly thought that natural juices should decrease stone formation. But in current day and age, we see that most of the juices which are available as beverages have artificial colorings, preservatives, sweeteners, and additives such as calcium ascorbic acid, which severely limit the health benefit of these beverages for kidney stone formers. So their benefit are not very clearly defined. That's why the preferred fluid for hydration in stone formers is supposed to be water itself, not fruit juices, despite them having higher citric acid content. One thing which many studies have showed that soft drinks, particularly those are acidified using phosphoric acid, have significantly increased risk of recurrent stone formation, because these decrease the content of these decrease the pH of the urine, thereby causing precipitation of calcium stones. And sugar sweetened soft drinks consumption was associated with increased uric acid secretion in urine, thereby causing uric acid stone formation also. Another beverage which is very commonly used in our everyday lives and households is tea and coffee. A systemic review and large cohort study supported general role of tea and coffee against stone formation. The primary effect was it increased the total fluid intake, and there was also associated antioxidative effect of phytochemicals such as polyphenols, which could be possible explanation for preventive effect of tea consumption. Lifestyle modification, as we previously saw that patients, particularly those who are obese, have metabolic syndrome, diabetes mellitus, are at increased risk of stone formation. Altering such lifestyle, which is like exercising less or playing just indoor games like video game, like going out less outside, so changing these habits to more active healthy lifestyle can reduce the risk of stone formation. coming to the secondary prevention part of it, if you develop any symptoms which are suggestive of stone formation, particularly pain in flank region, first important thing is to visit a urologist or a doctor nearby. And particularly, you have to get metabolic screening done in case you have history of recurrent stone formation. There's a strong family history of stones. There's some intestinal disease, particularly which involve chronic diarrhea. Pathological skeletal fractures are there. History of weak bones or osteoporosis. History of again and again getting of burning feeling while passing urine, which includes urinary tract infection. History of multiple various types of stone like cystine, uric acid, struvite, history of gout, or patient is just has solitary kidney or other known renal anatomic abnormalities. In such cases, patient should usually undergo metabolic screening because this helps in identifying high risk patients and evaluating and giving secondary prevention or pharmaceutical prevention of renal stones, as I would be discussing it further. So if patient had previously was diagnosed with renal stone and underwent stone analysis, so we can also give stone type specific recommendation for stone prevention. Like patient with calcium stones are usually associated with metabolic abnormalities like hypercalciuria, that is increased calcium in urine, or decreased citrate in urine, increased oxalate in urine, or increased uric acid in urine, or magnesium in urine. Here we can see citrate and magnesium acts as preventer of stone formation. So in such condition, we usually tend to prefer give citrate in hypocitraturia, and in hypomagnesuria, we tend to give magnesium. Well, in condition with hypercalciuria, we can give alkaline citrates because citrate prevents precipitation of calcium, thereby it will be helpful, and hydrochlorothiazide because thiazide diuretics decrease calcium excretion via kidneys. Similarly, hyperoxaluria can be tackled using oral calcium supplementation as well as magnesium supplementation or pyridoxine. Uh, Coming to next, calcium phosphate stones. These are basically carbonate apatite stones. These can, if patient is having hypercalciuria, again, thiazide diuretics could be helpful. Patient should be evaluated for hyperparathyroidism and one should exclude renal tubular acidosis, urinary tract infection, and try to adjust urinary pH towards a little more alkaline side, toward that is 5.8 to 6.2 using L-methionine. Bruchide stones, hypercalciuria, again in this is treated using hydrochlorothiazide. One should evaluate for hyperparathyroidism and exclude renal tubular acidosis in such cases. Coming to uric acid stone, hyperacidic urine, particularly one having pH less than 5.5, is the main culprit for precipitation of uric acid in urine. Alkaline citrate, that is potassium citrate, which is used, its dose can be ranged from 9 to 12 grams per day, or sodium bicarbonate, which increases urine pH to about 6.2 to 6.8. This will help in decreasing the uric acid stone formation. If there is associated hyperuricosuria or hyperuricemia, one can also supplement using allopurinol. Ammonium urate stones, which are relatively less common, one has to treat the UTI associated with it, and L-methionine can be used to target pH between 5.8 and 6.2. Coming to struvite stone or staghorn stones, these actually require complete surgical removal so as not to let any nidus of infection be present to again cause stone formation. Antibiotics, long-term prophylactic antibiotics can also be used. Urine acidification is required using ammonium chloride or L-methionine. And urease inhibition can be used using acetohydroxyamic acid at 15 mg per kg per day dose. Cystine stones, these are one of the stones which have higher morbidity and highest recurrence rates. They require hydration with more than 3.5 liter per day of water, or urine volume is output should be more than 3 liter per day to prevent its formation. One should alkalize urine with a urine pH range of 7.5 to 8.0 to prevent such stone formation. If cystine excretion is more than 3 millimole per day, one can also try giving tiopronin 250 mg per day. So here are specific medications which can be used to prevent particular types of stone, like alkaline citrates are useful in calcium oxalate, uric acid, and cysteine stones. Allopurinol can be used in calcium oxalate, uric acid, ammonium urate stones. Calcium, supplemental calcium can be used in enteric hyperoxaluria, which usually leads to calcium oxalate stones. Similarly, captopril, febuxostat, there are multiple host of drugs which can be used in similar conditions, which I have discussed under stone-specific prophylaxis. So the take-home message from today's talk I'd like to give is fluid intake. Drinking advice, I would like fluid intake amount should be at least 2.5 to 3 liters, so that daily urine output at least is 2 to 2.5 liters per day. What is the preferred fluid? And specific gravity or weight of the urine should be 1.010 gram per day. Nutritional advice should be balanced diet, not too heavily tilted toward animal protein content, should be rich in vegetable and fibers. Calcium content should be kept normal, and limit sodium chloride intake to about 4 to 5 gram per day. Lifestyle advice to normalize general risk factors. BMI should be maintained in a normal range. Every person should have adequate physical activity. Balancing of excessive fluid loss, like working in excessive dehydrating condition or excessive heat, one should take care of hydration. Reduce intake of alcohol containing fluids and reduce intake of sodas and calorie containing fluids. So that would be my take home message. So one of the most important is knowledge and tools are as good as the hands that wield them. And I hope everyone learned something from today's talk. Thank you.
Thank you, Dr. Harshit, for such a wholesome and excellent presentation. If we look at the renal stone disease, this is one of the few diseases wherein the dietary and lifestyle factors lies at the very core of the etiopathogenesis of the disease. And herein underlines the role of adoption of healthy lifestyle and healthy diet. Because if we see the renal stone disease formation, it follows simple chemistry rules. So there is a solvent and there is a solute. So whenever the concentration of the solute increases in the urine, their precipitation and subsequent stone formation occurs. So to decrease or to prevent the renal stone formation, either we should increase the solvent, so that thereby meaning that we should increase fluid intake so that the absolute concentration of the solute decreases, or we decrease the intake of the solute, that is calcium oxalate, which is the calcium oxalate is the most common stone. Around 60% of the patient have this. So decrease in oxalate rich diet, increasing fluid intake, and adopting a healthy lifestyle, decreasing your weight, controlling diabetes and hypertension. There are the primary basic things which everyone should pursue to have a healthy kidney free from stones. Despite the advances in the development of management of renal stone disease, the incidence has been increasing. So I think there is a growing need to educate the masses as well as the primary care physicians to adopt this primary and primordial prevention measures, so that we can decrease the burden on patients, on physicians and healthcare systems. So with this, I would like to conclude, and I wish you a very healthy kidney free from the stones. Thank you.
Thank you so much, Dr. Vikas and Dr. Harshit, for a wonderful presentation. Any questions regarding this first session can be put up in the chat box, and we and our experts will answer those questions. Meanwhile, now I introduce Dr. Sharon Kandari for the second session. She is our assistant professor, Department of Nephrology. So, Dr. Sharon, you may please proceed with the session 2, which is prevention of kidney diseases. A very important topic for the masses. Thank you.
Thank you, Dr. Ankur, for this kind introduction. I would like to thank the Telemedicine Society of India for giving up this platform on the occasion of World Kidney Day month, where we can discuss less discussed topic of prevention of kidney diseases. And thank you all the dignitaries who are present today, all the members who have joined. So one very important topic and disease, renal stone, has been discussed by our urology team. We, the nephrology department, will be focusing on, in general, the prevention of kidney diseases in general population, and how to delay the progression of chronic kidney disease in the patients who already have kidney disease. Because we know that CKD, that is chronic kidney disease, is not curable. We cannot cure it. We can only prevent its occurrence, or we can delay its progression. Because ultimately, once there is advanced renal failure, dialysis, hemodialysis, or peritoneal dialysis and renal transplant are the only options to sustain life. And being a country, because of cost issues, lack of resources, just 5 to 10% of these patients actually are fortunate enough to get this definitive treatment. So prevention, early detection, and right treatment at each stage of chronic disease, chronic kidney disease, is the only thing that can progress and prevent the burden on our healthcare system, and as well as decrease the morbidity of our patients. So I would like to call my our DM resident who is undergoing training in nephrology, DM nephrology at AIIMS Rishikesh, Dr. Devdas Sindhu, to begin the presentation on prevention of kidney diseases in general population and in patients. Devda, you can start.
Thank you, ma'am. Good evening, everyone. Ma'am, is my screen visible?
Yeah, visible, and you're audible too.
Good evening, everyone. Today I'll be presenting on prevention of kidney diseases, precautions for healthy and kidney patients. So today we'll be discussing on what are kidneys and what do they do, who are at risk for kidney diseases and ways to prevent kidney diseases, some myths and facts. So kidneys are two bean-shaped organs located in the upper back of the abdomen on either side of the spine. And kidneys are vital organs that keeps our body clean and healthy by flushing out unwanted excretory and toxic materials. So malfunctioning of this organ can cause serious illness and even death. So what do? They remove waste product and excess water in the form of urine. In addition to that, they keep the right amount of minerals, that is sodium, potassium, phosphorus, calcium, magnesium, chloride, bicarbonate, acid-base balance in our body. They control the blood pressure by the renin-angiotensin-aldosterone pathway, and they keep bones healthy by synthesizing the active form of vitamin D and by regulating the reabsorption and excretion of calcium and phosphate. They make red blood cells by producing erythropoietin. So today, why are we bothered about the kidney diseases? So because in the statistics says the CDC 2022 data sheet shows that approximately 15% of all age group patients are affected by chronic kidney disease at this point of time. That is more than 1 in 7 of the US population adults, amounting to nearly 30 million people, are affected by chronic kidney disease. And if we see, the two most important causes of chronic kidney disease is diabetes and hypertension, and the prevalence of this disease in them is even more higher. In diabetes, it is 1 in 3 adults with diabetes have kidney disease, and 1 in 5 adults with high blood pressure have kidney disease. Not only the prevalence, having a kidney disease predisposes the person to other illness like heart diseases and strokes. So how do we know whether a person is having kidney disease or not? It is seen that most people have no symptoms in the early stages of the disease, and the kidney disease usually gets worse slowly over time. It's not rapid in onset most of the times, and they may not have symptoms until the kidneys are badly damaged. So most of the times, the only way to diagnose is to get it tested. Having said so, there are some symptoms which we need to look into and which may guide us whether the patients have kidney disease or not. For example, patient may present to us with swelling in feet and ankles, which may progress to swelling in the abdomen and the facial puffiness. Patient may complain of decreased urination previously compared to the previous frequency and the volume of urine. The present frequency and volume may be decreased. They may complain of nausea and vomiting, not feeling hungry for quite some time, and feeling of dryness of the skin and itchiness of the skin. Sometimes the main complaint would be just muscle cramp or easy fatigability because of anemia. Difficulty in breathing could be one problem because of fluid in the lungs or severe anemia. Trouble sleeping because of fluid overload can also be a symptom. Sometimes some patient presents with some other symptom by which we need to diagnose kidney disease. One such presentation is anemia. Severe anemia disproportionate to the age and sex, we should look for kidney disease in them. Anemia is not enough red blood cell in your body, which can make the patient really feel tired. Second presentation is gout. It is a type of arthritis that causes pain and swelling in the joints, predominantly in the big toe. And if a patient presents with this, we should do his renal function test and evaluate for kidney disease. And third thing is hypertension, particularly in young patients, which is which we are not expecting it to be primary hypertension. In them, we have to get evaluated for kidney disease. So coming on to who can get kidney disease, who are at risk of getting kidney disease. Patients with diabetes, patients with high blood pressure, patient with a pre-existing heart disease, a patient with a family member having already kidney disease, like genetic diseases can be there. Patients who are chronic smokers can have atherosclerotic vascular disease affecting the kidneys. Elderly patients who are more than 60 years of age, all these are predisposed. Not only this, quite recently, other conditions are also predisposing to kidney disease, like obesity, chronic intake of over-the-counter painkillers, and congenital birth defects in form of congenitally a single kidney or congenital abnormality of any urinary tract. These patients should be screened for kidney disease when they present to us. So having said so, I have discussed the what are the kidney diseases, the prevalence and the symptoms. It is often possible to prevent kidney disease before they end up in the later stages. So for this, we need 4 steps. One is, I already mentioned the important cause for kidney disease is blood pressure and diabetes. So first, control the blood sugars if the patient has diabetes. That will prevent the progression of prevent the onset of kidney disease as well as the progression of kidney disease. Then control of blood pressure if the patient has high blood pressure. A healthy diet and an active lifestyle will help prevention of kidney disease. So I'll be discussing each one. First, I'll be discussing ways to manage diabetes. So patients with diabetes should visit their physician and get the medicines instructed for them at regular basis and follow up. They should check for their blood sugars level often and should maintain a target blood pressure of less than 7, target HbA1c of less than 7 for control of diabetes. And in diabetes patient, a lower target of blood pressure is targeted, that is less than 130 by 80 millimeter of mercury. They should be referred to a dietitian for an appropriate diet plan so that they can decrease the progression of diabetes. For maintaining a glycemic index, this ADA has recommended a range. Before eating a meal, 70 to 130 milligram of deciliter. Sugars should be maintained 2 hours after meal, less than 180 is the target. And at bedtime, try to keep sugars between 90 to 150 milligram of deciliter. So having said so, now when to diagnose diabetic kidney disease. So when to screen for these patients. As we know, there are 2 types of, in them other types also, but commonly 2 types, type 1 and type 2 diabetes. In type 1 diabetes, we screen for kidney disease after 5 years of onset. And in type 2 diabetes, we screen at diagnosis of type 2 diabetes. And how do we screen? We screen by 2 important investigations. One is we ask the history, of course. And secondly, by investigation, we do urine for albumin and we do blood investigation, serum kidney function test. So how frequently do we screen? After the diagnosis, in both type 1 and type 2, we have to start screening for kidney disease yearly. So ways to control high blood pressure is the second modality of preventing kidney disease. So again, the patient should be on regular follow-up with the doctor and should take the medicine as instructed. Blood pressure should be checked at home at regular intervals, and a healthy diet plan should be given to the patient with a limited sodium of less than 2,300 milligram and a healthy fat and lean protein. An active lifestyle should be advised. So coming on to the diet, which is an important component in prevention of kidney disease, as well as in patients with an already having pre-existing kidney disease. So I'll be discussing in 2 different headings. One is diet in preventing kidney disease and diet in patients with kidney disease. So in diet in preventing kidney disease, So prevention of kidney disease, important component is control of diabetes and control of hypertension. I would be focusing on the diet which controls diabetes and hypertension. So important steps would be to limit your salt and sugar intake, choose healthy fats, eat more fruits and vegetables, and control portion sizes of the food. So to limit sodium, sodium should be less than 2,300 milligram or less a day. So the important form of sodium which we take is a common salt and the baking soda powder. So common salt, these foods are highly rich in salt, like papad, salted pickles, salted chutneys, sauce, chaat masalas, popcorns, salted groundnuts, salted cashew nuts, all these, and Indian snacks like save. So try to avoid these foods. Coming on to the second source, that is the so baking powder, which is also having the sodium. So any baked items like pakoras, doklas, dahi vadas, biscuits, cakes, pizzas, try to avoid. Other than that, commercially available salt, butter, and cheese are also there. And these should, and instant foods like noodles, macaronis should also be avoided. So we have avoided the salt rich food. So how to reduce the salt in the normal diet which we eat? So try to cook food separately and take the appropriate amount of restricted salt separately and add to it according to taste and according to the measured amount only. So avoid seasoning of the food. So basically avoid keeping the salt shakers on the dining table, and read food labels before eating a packaged or processed food. So for in this example, in this picture, I have mentioned like this is a food product which is having a sodium content of 460 milligram, that is 20%. So it is said that more than 20% of daily volume of sodium is considered as high sodium content of the food. So try to avoid these food. And third thing is some vegetables also contain high sodium content. For example, bell pepper, carrots, tomatoes. So boil these vegetables, filter the water away, and then add taste and have the food. So for adding, we have removed the salt, so there is no taste to the food. So after removing the salt content, you can add taste to the food by adding garlics, onions, vinegars, green chilies. Nowadays, there are some salt substitutes like onion powders, rosemary and all, but these should be avoided as they have high content of potassium in them. And do not drink softened waters as they have the calcium in the water is replaced by sodium. So coming on to the second restriction, that is sugar restriction. Choose foods with natural sugars, like eat a whole fruit instead of eating sweetened products like cookies, cakes, candies, and avoid drinking fruit juices because the same one fruit would be filling, but for the same in the fruit juice, you would be using 3 to 4 fruits which are high calorie content. Avoid processed packaged foods like cereal bars, packaged lassi. Avoid sugary drinks like sodas, sweetened teas, and coffee drinks. And even for sugar, read food labels. For example, in this example, the total carbohydrate content is 27 gram, whereas and out of which the 23 gram is added sugar, which is 46%. So in this, in the FDA, it states that more than 20% of added sugar of daily value is high sugar content, and it should be avoided. Choose healthy proteins. If you're a non-vegetarian, then you can choose lean meats or fish as a healthy protein. And if you're a vegetarian, even if non-vegetarians, try to use more vegetarian protein instead of meat as it has lesser phosphate content. Then about the fats, there are 3 types of fats. Choose unsaturated fats preferably. What are unsaturated fats? For basic knowledge, I'm telling they are liquid at room temperature, like sunflower oil, safflower oil, olive oils, and limit saturated fats. Saturated fats are solid at room temperature, like butter and cheese. And completely avoid trans fats like man-made fats, hydrogenated oil, daldas, etc. Eat more fruits and vegetables and whole grains to prevent kidney diseases. Choose whole grain wheat, bread, and oatmeals. So coming on to the second component of the diet, that is diet in patients with kidney disease. So diet component most of the time remains the same. I'll be discussing on 2 important things, that is fluid restriction in this patient. So in most of the patient with kidney disease, fluid restriction is important, but not in all. So this should be prescribed by the physician. To avoid fluid overload or deficit in patients who are having decreased urine output, we usually tell them to measure the urine volume for 1 day in the week, and the next day they have to supplement the fluid only not more than 500 ml. And the patient should weigh themselves daily so that they keep a like chart of how much weight gain they are having, so that they start concentrating more on fluid restriction. So we have mentioned fluid restriction, but how do the patient reduce their thirst? So we have to tell them that reduce salty and spicy and fried food in the diet, because these are the important components of thirst, and drink only when you are thirsty. Do not make it a habit to drink water. When you are thirsty, take a small amount of water, and even small amount of water, keep small cups of water. Do not keep big bottles of water in front of them, and try ice if feeling thirsty. And in situations where they're extremely thirsty and more intake of water is there, you can ask them to gargle with water without drinking it. And some people can even be given chewing gums, sucking hard candies or mints, and use of mouthwash if the patient is telling there is dry mouth, because of which he's drinking more water. And take medicine. Importantly, most of the patients tell us that they drink more water because they tend to take medicines. So explain them most of the medicines, try to ask them to take after a meal, because after a meal anyways they have to take water, and that will decrease the total amount of water intake. So another component of the diet in kidney disease is the restriction of potassium. So in the food labels, see for the amount of potassium. High potassium is when it is more than 200 milligram per 100 grams of food, and low potassium if it is less than 100 milligram per 100 grams of food. So I have kept a photo which is showing potassium rich foods, like for example, in fruits, oranges, orange juices, bananas, mango, kiwi, and raisins, pomegranate are rich in potassium. In vegetables, green spinach, beet, potatoes, tomatoes, pumpkins, and in other food items, chocolates, nuts, yogurt, raisins, and importantly, coconut water and rock salt is also rich in potassium. So amongst the vegetables, we have to eat vegetables because we need to get the nutrient. So how to remove the potassium content in the vegetable? So tell the patient to wash the vegetables and soak them in lukewarm water and put them in a large pot. This should be soaked for at least 1 hour. After that, after soaking the vegetables for 1 hour, rinse them with water 3 to 4 times, and then boil the vegetables with extra water and discard the extra water. These vegetables can be used for cooking. So first I have discussed about the water restriction, and then I discussed a potassium restriction. My friend earlier has discussed about phosphate restricted diet. So now I'll be telling about controlling the serving sizes in patients with chronic kidney disease. So eat slowly, ask them to eat over 20 minutes and stop when full. Check the nutrition label of each of the food, which I mentioned earlier, and measure or estimate food for the correct serving size. For patients in rural areas, they can have an approximate a measure, like a small fist is 1 cup, a half cupped hand is half cup, and a tip of the index finger is approximating to 1 teaspoon, and at the tip of the thumb is approximating to 1 tablespoon. So a healthy kidney friendly meal it is not starving, it is eating an appropriate meal. So a plate may have half palm sized serving of protein, a cupped handful of fruits, a cupped handful of grains, and a cupped hand of dairy, and a fist size of vegetables, and a thumb size of healthy fat. Be active. That is, being active can help control blood pressure and diabetes. Set a goal to be active for 30 minutes a day, 5 days per week. Start slowly, like add an extra activity every day into the routine. For example, a patient can be asked to take a walk after a meal, and find activities which the patients enjoy, like dancing, gardening, playing a sport. Any activity would help. So coming after the diet, I'll be discussing on the drugs that can damage the kidney. So any patients with a pre-existing kidney disease should tell the doctor, physician, that they already have the kidney disease, because many of the commonly used drugs can put the kidney at damage. A few of them are antibiotics like aminoglycosides, NSAIDs, that is non-steroidal anti-inflammatory drugs, and heavy metals which are found in alternative medications. So I'll be discussing in detail about non-steroidal anti-inflammatory drugs. What is NSAIDs? They are non-steroidal anti-inflammatory drugs which are commonly used as over-the-counter painkillers for pain, fever, and inflammation. These drugs include aspirin, diclofenac, ibuprofen, indomethacin, nimesulide, naproxen. So do NSAIDs cause damage to kidneys? NSAIDs are generally safe, provided they are taken in correct doses under the supervision of the doctor. Exceptions are patients who are at risk for kidney disease, which I have mentioned earlier, should be given with caution. For example, elderly patients, patients with a pre-existing kidney failure, patients who are already having diabetes, hypertension, dehydration, who are having renal stone disease, congenital anomalies of the kidney and the urinary tract at increased risk for kidney damage post usage of non-steroidal anti-inflammatory drugs. So I have told in these patients, we cannot use non-steroidal anti-inflammatory drugs. So which painkiller is safe for kidney failure patients? So we commonly use paracetamol, but under prescription of the physician, if the pain is uncontrolled with paracetamol, tramadol can be used. So coming on to the myths related to kidney disease. So this is I have discussed most of the topics before. I'm just, these are the common questions which the patients put to us in OPD. So all kidney diseases are incurable? No. Because we are one more chronic kidney disease, even in the initial stages 1 to 4, we can even decrease the rate of progression of the kidney disease. And other diseases like acute kidney injury, nephrotic syndrome, glomerulonephritis are all most of the times curable based on the etiology. And second question which they ask us, kidney failure can occur even if one kidney fails. So for an healthy adult, even one single healthy kidney functioning kidney is sufficient for the metabolic excretion of the waste product and the minerals. So one kidney is healthy enough. And third question which they put is, I am fine, so I don't have a kidney problem. It is not so. So I told that most of the patients in the early stages of the kidney disease will be asymptomatic. So when they are at risk, like the risk factors which I mentioned, the people who are predisposed to have kidney disease, even if they don't have any symptoms, they should be screened for kidney diseases. The other myths are all patients with kidney disease should drink lots of water. No, I have mentioned already. This depends on the urine output, the kidney disease of the patient. So the water prescription is an important component of the patient for the patients with kidney disease. So this should be consulted with the physician and then decided. And the very common question which is forward is dialysis cures kidney. So a short note on this, dialysis is an extracorporeal therapy which removes the excess water and metabolic products from the metabolic excreted products from the body and maintains the mineral balance, which is the same function of the kidney. So it functions as an extracorporeal kidney, and it does not cures the kidney. The kidney which is affected by the primary disease needs to be treated for the kidneys to get cured. So dialysis does not cure kidney. And dialysis performed once becomes a permanent need? No. Actually, dialysis is given for many conditions like acute kidney disease, acute kidney injury, and for any metabolic reasons. So only in patients who are CKD5 in end-stage renal disease who are started on dialysis have a permanent need for dialysis, and other conditions do not usually end up in permanent need for dialysis. So take-home message would be: take steps to manage your diabetes, take steps to control high blood pressure, make changes to eat healthy, avoid over-the-counter painkillers, and take steps to be more active. Take care of your kidneys and they will take care of you. Thank you.
Thank you, Dr. Devda, for such a beautiful pictorial and thorough presentation. You proceeded nicely, sequentially, told us about the symptoms initially which are presenting as kidney disease. Then you told us about the risk factors like diabetes, hypertension, which is the most common throughout the world, not only in India. and risk factors, and then you progressed nicely to the prevention, where you focused on the diet, about the salt, sugar, low sodium diet. You told us about the portion sizes nicely, about the handful, teaspoon, tablespoon. You mentioned about how the thirst should be controlled, because that is a very commonly asked question, that we cannot control our thirst. So in the end, I would like to just focus and say something from my side, that when we are in the OPD, what routinely in the clinical practice, we see these 5 things which I would like to highlight right now, which we generally see, which are being neglected many a times throughout by the population. That a patient with diabetes 5, 10, 20, 25 years, sometimes in cases like 25-year-old diabetic patients, they come to us that this is the first time that they have checked their KFT throughout their history of diabetes mellitus. So this should not be done, as told by Dr. Devda, that as soon as type 2 diabetes mellitus is diagnosed, patients should have their kidney function test checked, and in type 1 diabetes after 5 years. Then the most common thing nowadays is young people are presenting to us with cardiac arrest. Onset hypertension is very common, and in any young patient, secondary hypertension, as to rule out secondary causes, kidney function test must be done in these patients. Then routinely seen patients with anemia, hemoglobin is low, all the variety of tests have been done, hemoglobin, retic count, all the hemolysis workup, everything is done, but KFT has never been checked in these patients. So kidney function test must be checked in these patients. And also most prevalent thing, gout. Every person says uric acid hai, but they fail to check their kidney function test. So these 4 diseases should immediately we must focus to check kidney function test as soon as these things come to our site in the clinical practice. And then over-the-counter drugs, like most commonly used by everywhere patient can go to the local pharmacist and they give painkillers, diclofenac, ibuprofen, nice, very commonly. So NSAIDs are very strong risk factors to cause AKI, and itself can result in chronic kidney disease in any patient, in general population too. So we should avoid over-the-counter drugs. So yeah, this was a nice presentation. And any questions from any member if you'd like to ask? Thank you.
So I think very nice presentation by both the speakers and very good insight by both the experts. So any questions regarding the second presentation we can take now from the house?
Yeah, Dr. Ankur, one question can I ask?
Yes, sir, please go ahead.
Yeah, actually, in practice, we see that most of the patients who are coming with renal stones or ureteric stones, they have been advised that Alka-Sol or this kind of urinary alkalizer without even testing their urinary pH or their dietary habits, etc. While sometimes this may actually be counterproductive, right? So what is your take on that? When actually should the practicing physician or surgeon or urologist, whoever is treating with them for renal stones, must start this alkylating agent? And second question is, what do you do for those patients who are having family history of renal stones, or in whom there is no other dietary or some kind of a factor, but there is a hereditary factor for renal stones? How you manage them?
Dr. Vikas, would you like to take the question?
Yeah, yes, sir. Sir, this Alka-Sol is given over the counter. Every primary care physician, whenever he sees a stone, even though it is a ureteric stone, wherein this Alka-Sol will not work, they usually prescribe it. The reason behind prescribing Alka-Sol and alkalizing the urine is that the most common stone in Indian population, although the data suggests 60%, it is more than 60%, maybe 80%. There are just few cases like cystine stone wherein this Alka-Sol may be counterproductive. So giving that benefit of doubt, this has been given off and on and again, although we recommend that in a patient of recurrent stone disease, he should undergo metabolic evaluation. That also answers your second question, a patient with a family history of disease. So these are high-risk patient, as shared by Dr. Harshit in the chart, a recurrent stone former, family history of renal stone disease, history of gout or bowel disease. These patients should undergo metabolic evaluation. Metabolic evaluation means we test for hypercalciuria, we test for oxalate levels, we test for electrolytes level, And these things then help us in knowing what is the underlying metabolic abnormalities. Until and unless you correct these metabolic abnormalities, the patient is bound to again have these stones again and again. So I think metabolic evaluation will solve this problem and will correct the metabolic abnormality.
I think the answer is very clear to all our patients that these over-counter potassium citrate or other form of citrate solutions are not recommended without the advice of a physician, because the more important is to maintain the urine pH in a normal range. If it is more acidic or if it is more alkaline, both is harmful for the patient for renal stone disease, because as the acidic urine also can be a culprit for stone disease, for some stone disease, and the alkaline urine can also be a culprit from the other stone disease. So maintaining that level is very important. So I think it is not recommended, and I think that answers the question. Thank you.
Thank you, Dr. Ankur and Dr. Vikas.
Thank you, sir.
Thank you.
So I think with this presentations, the theme basically the Council of TSI UK is acting on under supervision of Professor Meenu Singh Ma'am is preventive medicine. So I think this first webinar was on preventive medicine. The other webinars which will be coming in maybe a planning will be again on preventive medicine by some other subjects, some other subject experts. Now I would request ma'am to have some few
Can
words.
I just wanted to make a comment. First, both the presentations were really good, and I think we all learned a lot. My only thing is that I think in future we can also use the eco model for for our webinars for the Uttarakhand chapter, and we can have some of our participants present the cases. In eco, actually, this is the extension of community health outcomes, in which the people who get connected to us, they discuss their cases, and the experts give their comments and discuss further. This can be planned in a sort of, it can be done in a planned way. So mostly then these become case-oriented discussions. So that makes them even more interesting. Although both the presentations were very good. And for that, we can liaise with ECO, and we are already doing it for some other subjects. So then you don't have to keep increasing your Zoom thing, then you get your Zoom for free and you can extend your time limit. So at the moment, the Zoom that we are using is that we have subscribed, we have bought this, or is it only for 40 minutes?
This is a Zoom platform which we are using from the headquarter TSI, and
okay, all right. So this we are getting for free then. Okay, then I think we can go our own way. There is no need to be absolutely hooked to ECO or any other thing.
Yes.
So thank you very much. Very good.
Thank you so much, ma'am.
Yeah.
I think with this we can end the presentation today, and we'll keep the house updated about the other presentation which will come in the near future, maybe next month. Thank you so much. Thank you, everyone.